Hi everyone, welcome back to the Dr. Sia channel. In the video here today, we're going to be looking at the 7th most common mistake that beginner ISTDP therapists make, which is not checking for agreement. Let's get started. All right, so one of the most common mistakes that I see myself have done so many times before, and I've seen my patients do, my supervisees do so many times in the past, is not checking for agreement. And what I mean by checking for agreement is if you've ever seen, the master therapists at work, and for example, if you've ever seen Alan Abbas at work, he's constantly checking for agreement, constantly, almost after 3 or 4 or 5 or 6 interventions, he's then checking for agreement. And what I mean by agreement is therapy has a task. And just because you know that that task might be beneficial for your patient, it doesn't mean that your patient agrees. We need to, not just once, but almost perpetually and repeatedly check for the patient's agreement that they want to, they desire to, they wish to engage in that task with you, whatever that journey is, whatever that path is, whatever it is that you're going to do with them. You need to check that they want to do that with you. I think being able to do that repeatedly and over again and consistently between patients and within your sessions with the same patient is a very strong factor that explains and predicts alliance between you and your patient. And I don't need to tell you how important alliance is. So it's kind of like, I've noticed that many of my supervisees, and I've looked over a lot of my own tapes, and I noticed that I kind of make assumptions that way, that I would go, what are the problems that you're having? And the patient goes, I'm anxious. And I go, all right, so what causes your anxiety here with me right now? All right, fair enough, that might work. But I find that recently, for me to just do a short intervention in between there, where I ask for the patient's permission to look at their anxiety, see if they want to look at that anxiety with me before I say, so what causes that anxiety, is very helpful. So I've kind of changed it from what are the problems you're having, or what are the internal problems that you're having here that you want to work on with me here right now, depending on, kind of how you start your session. It doesn't really matter, as long as those kind of core bits are there and you know where you're going. That's the most important bit. So I would say, what are the problems that you're having? And the patient might say, I'm anxious. And then instead of jumping into saying, so what causes your anxiety here right now? I might say, do you want to look at that anxiety here with me right now? Do you want to look at that anxiety? Do you want to talk about that anxiety? Do you want to examine that anxiety? It doesn't really matter, which one of these you choose, as long as you're consistent so you don't throw yourself off, and as long as you do it intentionally and you know where you want to go with it. But checking whether your patient wants to look at it with you can help you clear out a lot of barriers to therapy. It can help you clear out a lot of assumptions that really will help you put the I in ISTDP, that will help you put the intensive into ISTDP, and it will help you put the short term in short-term therapy as well. Because so often I've seen my students kind of go, what are the problems you're having? And the patient sits down and goes, yeah, I'm anxious. And the patient goes, all right, so what do you think causes that anxiety here right now? And the patient goes, yeah, they answer, and they're trying to kind of, it almost seems like they're a bit with the therapist, and it kind of seems like something's going forward there. And I might look at the video and I go, you don't have a patient right now. Like, this patient is not with you. Like, can you not sense that? Can you not see that? Like, and so often I've asked them, I said, well, next time you go back to therapy, you say to that same patient, when they sit down and you say, where would you like to start, or what are the problems you're having? And they say, I'm anxious. You ask them, first of all, would you like to look at that anxiety? So I think that's one of the most kind of important things, because it immediately allows the patient to go, no, I actually prefer not to look. I actually prefer not to talk about it. I actually don't think it would be useful for me to talk about my anxiety. I think it would be more useful for me to avoid talking about my anxiety. I think it would be more useful for me to avoid just about everything. Actually, I just kind of came here hoping to sit here and avoid the whole session. And of course, if you've been doing ISTDP for a while, you can see that sentiments like that are very frequent in your patients that they come, they sit down, and they're in front of you, and they might declare a problem, but they might not want to look at that problem. So one thing that I learned from being at these Alan Boss workshops, it's constantly looking at agreement with the patient. Your patient says they're anxious. Do you want to look at that anxiety? Do you want to look at what's underneath that anxiety? The patient might go, I have some feelings, and you might jump in there and go, what are those feelings? But Alan Boss would kind of go, do you want to look at those feelings underneath that might be causing your anxiety? Like, it's just constantly checking for agreement with the patient. And I think that is a very healthy thing for us as therapists to do. I think it's a good, solid kind of intervention to repeatedly bake into the standard run-of-the-mill kind of interventions that you might be using on a day-to-day basis, because it will really help you clear out possible barriers to therapy as you go along. A patient might come in motivated the first 5 minutes, and they might not be motivated once they notice that you're useful. They might come in motivated and not be motivated as much when they notice where you're going with therapy. So for you to be asking, do you want to? Do you wish to? Do you desire to? Repeatedly and frequently, that's really useful. Now, I've been holding a sneeze for a long time, so I should sneeze, but I should say goodbye first. Thank you for watching the video. I hope you enjoyed it. I hope you got something out of it. And please comment, let me know what you think. Please subscribe, press the bell button, all that jazz, so I can pop up into your phone when you're least suspecting it. Gotta go. See you for the next one.